There are two really important tools that can help you, and the first is long round burrs. They're called Munce burrs, M-U-N-C-E burrs. They make them in 6 sizes, and they are available from a company called CJM Engineering.
I'm sitting here at the DentalWorld conference with Dr. Glenn Fanas, who is referred as the best endodontics of whole Canada. So Dr. Glenn Fanas, thank you very much for being our guest today.
Thank you. Thank you for having me.
For those who couldn't attend, could you please summarize what your lecture was about?
Yeah, my lecture today was a little bit about magnification, how to use magnification to find more of the MB2 canals in upper molars. So my lecture spent a little bit of time discussing why microscopes can help you to see and how beneficial magnification and illumination was, what some of the choices were for magnification out there, and it spent the majority of the time discussing clinical techniques and tips for finding the MB2 canal and showing some clinical cases of how I located it.
I think most of the dentists are playing with the idea of using magnification, but some of them haven't decided yet. Could you please tell us your story, why you started?
Yeah, I mean, I've been using the microscope for 22 years in my practice. I started with loops, 2.5 power loops, fairly soon after dental school. And at that time, magnification was not a common thing unless you got older. And I started to be able to see more, and I went from 2.5 power loops to 3.5, and then eventually to the microscope. And I've used the microscope for all of my dentistry for the last 22 years. So endodontics, restorative dentistry, even extracting teeth, implant placement. I'm doing everything in the office with the microscope. So today I talked a little bit about some of the literature that supported using magnification and how it could benefit you in endo. And I spent some time sharing my journey from over the last 30 years, from when I first started to now, and how the microscope has helped me with how I sit, how much more precision I can get, also documentation, being able to take video and stills of the cases.
And there was a specific patient who advised you to use it, right?
Yeah. You know, when I first started, I didn't really like dentistry, and my dad was a dentist, and I didn't like it. And it kind of came to a head after 7 years. I had a patient who I did a root canal on, and he kept complaining that when he tapped the tooth, it kept hurting. So rather than coming back to see me, eventually he went to the specialist, and the specialist said, well, there is the MB2. He found it under the microscope, and I had to give the fellow his money back. And he was leaving the office with the check, and he turned around. He said, "By the way," he said, "maybe if you're going to continue to do microscope or to continue to do root canals, you should get a microscope just like the specialist." And I felt so bad. I thought I better either stop doing root canals, or maybe I better try and do them like the specialist, so I didn't have that happen again. And that started my journey 22 years ago, and now we have 9 microscopes in the office. So it was a very important thing in my life. So.
And could you please share some of your tips, how it is easier to find the MB2 canal?
Yeah, I think there are two really important tools that can help you. And the first is long round burrs. They're called Munce burrs, M-U-N-C-E burrs. They make them in 6 sizes, and they are available from a company called CJM Engineering. Those round burrs are quite long, and you can watch them with magnification and trough both mesially and apically to uncover the MB2. So often people will see the MB2, but they're not able to actually negotiate it. And that is because the file goes mesially and then back towards the buccal along the curve. So if you can remove the first part of the journey and first part of the canal and go into the straight part, you can often negotiate it. So round burrs, long round burrs, Munce burrs help. And the second thing that helps is ultrasonics. So ultrasonics come in a variety of shapes and sizes. They vibrate quite fast and have water there. And you can use them to plane the floor of the pulp chamber to find the canal. So Munce burrs and ultrasonics can really help you to locate more MB2 canals. The number one failed tooth in endo is the upper first molar, always, and it's because you don't find the MB2. It's there in some studies up to 90% of the time, and so if you don't find it, I get very nervous. I get very anxious that I don't find it. It's probably there. Why is it not there? So I talked about that. I also talked a little bit about cone beam and 3D X-rays for helping you in difficult cases to find the MB2.
Dr. Fanas, thank you very much for sharing your knowledge with us.
You're very welcome.
It was a pleasure having you.
My wife and I loved Budapest, and the Dental World Show is something you cannot miss. If you don't come next year, you're missing a huge, huge convention and a great party. Thank you for having me.
Thank you very much, Doctor.